Thank you, chairs and members of the committee, and thank you for calling this hearing, having JCCA submit testimony on behalf of the children and the families to whom we provide services. My name is Marie Scalia, and I am the CEO of JCCA. I was sitting in the back listening to some of the testimony, and I think a lot of the same issues, having spent 11 years at the Department of Social Services and knowing the various issues that have come before you today, I am deeply honored to be able to sit here with all of us, and I think a lot of the same issues resonate. And I'll just point to JCCA in the sense that we are a child and family services agency that works with about 17,000 of New York State's children and families each year. We provide foster care, residential, prevention, educational, and behavioral health services to young people across the 5 boroughs and Westchester County. I'm here today to discuss the extreme challenges facing organizations like JCCA, as you've heard from other organizations, that care for children in foster homes and residential treatment centers, which JCCA has in Westchester. Research shows that young people in foster care disproportionately struggle with mental health challenges and are more likely to experience negative long-term health outcomes, as well as homelessness. In order to adequately meet the needs of young people, we are asking child welfare professionals to do more without providing proper compensation. JCCA's Residential Treatment Center cares for young people who have suffered the trauma of parental separation and, in many cases, repeated moves among foster families prior to their arrival. We work hard to provide a highly structured therapeutic environment for youth to heal, to leave campus, and to achieve success. However, we are struggling to deliver the holistic therapeutic services that our youth need. JCCA and our peer organizations are experiencing a workforce crisis. Children in foster care, particularly those on residential campuses, are detrimentally impacted by this instability. We therefore ask the state to do the following. First, advocate to sufficiently fund Article 29I programs to maintain a steady team of well-trained clinicians. Foster care agencies providing community and residential services used to be paid at a flat rate that included both room, board, clinical, and medical services. This changed, with clinical and medical services being carved out and paid through 29I services in the form of core dollars, which are supplemented with billing encounters. The core rate is not sufficient to staff these clinical positions, even with encounters supplementing that payment. The problem is twofold. Nonprofit clinical medical salaries do not match the market rate for these positions, making them not competitive. The other thing that we're asking is to advocate for foster care and residential staff salaries to be increased and maintained at a consistent and experienced workforce.
Thank you.
Thank you.
Ms. Scalia, it's great to see you.
It's good to see you, too.
Pleasure. And thank you for hosting me at your facility. And we had a good conversation, and I look forward to continuing to work so closely with JCCA. You guys are great.
Thank you.
I would like to let me start here. You look like you were cut off at the end when you were speaking. Did you have anything else you wanted to add?
Yeah, I think the thing that I really want to get across is that the living wage that we provide for our most important positions, we call them RYCs, the positions that work closely with our children in residential care. That salary is starting at $18.50. And that's based on the fact that we have to juggle there's a small amount, there's a core rate that is provided for our children. With that, we can only provide a certain amount of money for each of these titles. If you layer on top of that the need for licensed clinicians and everyone else. However, as other people have said in their testimony, $18.50 for people who work very, very closely with traumatized children who have to be there day in and day out to help model that behavior, to help them, is not a living wage that we can support.
I appreciate that, and I'd like to talk more and work with you offline to try to rectify that problem. And then thank you for your testimony.